Hi, I am Sinead of Prince and I'm going to perform post-mortem care. First is to verify patient has been pronounced dead by the physicians.
To confirm that death has occurred.
Then, identify cadavers and collects their belongings for labeling. To identify and to do the procedure to the right patient and to avoid lost belongings of the patients because it will be given back to their relatives.
Gather all the equipments needed.
Alcohol, comb, name tags, tray, gloves, towel, cotton balls, gown, and blanket.
To ensure that the procedure can be carried out effectively and without interruption. Explain the procedure and purpose to the relatives. To ensure that the relatives are aware of the patient's death and to provide support and gain their cooperations. Preparation of the body.
Next, wear gloves.
This is to reduce the risk of cross-infection and contamination with bodily fluids.
Then, strengthen the body and place him in a dorsal position with head and shoulders slightly elevated. For dignity and for future care of the body, discontinue the patient's oxygen, IV, and all drainage. Let's assume that we all remove the tube, catheter, and etc. of the patients. Because the risk of leakage of the bodily fluid should be remembered and suitable precaution taken. Next is denture. Place it inside mouth and close eyes and mouth. To hold the jaw and eyes closed to improve final appearance. Then, remove all marks of the adhesive plaster. This is for the hygienic and aesthetic reasons as assemble equipments at bed. For hygienic and aesthetic reasons. Next, assemble equipments at bedside so that the things needed are within reach. Bath patient, comb hair, red dress, wood if necessary. Now, let us comb this hair. To observe any leakage from the wound side, open wound post of health hazard to stop or others coming into contact with the body. Pack all the body of orifice with cotton balls if necessary. Pin loincloths like a diaper securely. Because leakage orifice may pose a health hazard to staff or someone in contact with the body. Next, put on gowns or clothes to dress up the patient. Now, let us all assume that I undressed the patient and I'm going to put on the gown. Ito ba gamitin o yung isa? Then, place the metal tag around the neck of the dress.
For dignity and to avoid movement and possible damage during transfer.
Place the second tag on the wrist and below.
This is to quickly identify the corpse.
Turn body and wraps snugly starting at the head part and the body, and fit by overlapping the end of sheet, securing ends with safety pins and place third tags on the chest. Removal of the body from the ward calls attendance to the transfer from the body room to the morgue. Decomposition occurs rapidly, particularly in hot weather and overheated rooms. Many pathogenic organisms survive for some time after death, and so decompositions may pose a health and safety hazard for the handling of the body. Then, place the body on the stretcher and covers completely with the sheets. Racks and sheet securely under the stretcher. This is to ensure that the lateral transfer can be safely performed. Next, complete all the records and chart of the patient. for the completeness and accountability. Next, body should not be allowed to stay more than 1 hour in the ward. Decomposition occurs rapidly, particularly in hot weather. Then, send chart to information. Death certificate is signed by the attending physicians. To be able to process the patient's death certificate and other important documents. Then, return leftover medication to the relatives. Because medication are already part of the patient's bills and it's paid by the patients or significant others. Give jewelry, if patient has any, to the relatives. This is to ensure adequate documentations regarding deceased belongings. Then, after care of the equipment, script bed and writes a discharge of the patients. This is to maintain equipment efficiency to provide quality care. Then, if a patient's disease is contagious, observe medical asepsis. To prevent cross-infections to healthcare staff and funeral directors. To prevent cross-contamination to healthcare staff and funeral directors. Then, return equipment used in the proper places. Let's all assume that we already returned the equipment in their proper places to avoid misplaced or loss of the equipment. Then, record time of death, pronounced death by the whom, if attending physician was notified, for completeness and accountability of documentations.